An anterior lumbar derangement is the exact opposite of a disc herniation. The disc is going too far forward, not backwards. During an assessment, it is important to look at the curve in their back, as well as their ability to bend forward, backwards, side to side. And then we're going to use repeated movements to see its effect on the baselines that we measured. In this picture, you can see that the patient lacks proper curve reversal. They're unable to bend their spine forward. Both knees to chest and lumbar flexion and sitting will place posterior pressure on the nucleus of the disc, pushing anything anterior back to center. After performing a set of knees to chest, we can see that the patient's curve reversal improved, but it's still not normal. We want to see a good C curve. This is a better picture of proper curve reversal. This is what your spine looks like. All the bumps along your back are individual bones, one on top of another. We call them vertebrae, but they're simply a brick wall protecting that spinal cord. You cannot injure that spinal cord or you're paralyzed. That's why your body developed a brick wall around it. But this also means you can't break any of these bones. If you break one of these vertebrae, they have a potential of cutting into that spinal cord. So your body developed a pillow above and below each of those bones to protect them. The pillow is called the disc. So the function of that disc is to absorb all the shock, all of the pressure, keep those bones healthy, keep all that stress away from the bones. This is what your disc looks like. Your disc looks like a jelly donut or your Nike running shoes. That jelly in the middle of the disc helps absorb all that shock and pressure. There's actually no nerves inside the disc because you don't want to feel every step. So you can actually cut or stab the whole inside of it. You feel nothing. Only the very outside layer is innervated. And that's innervated for a reason. Your body doesn't want this jelly coming outside. If the jelly comes outside, you got a flat tire and you can't protect those bones anymore. So when that jelly moves too far and rips through that very last layer, that's when you're going to have pain. So that disc, believe it or not, is very similar to your fingernails. Your fingernail's there to protect your nail bed. You can cut and rip your nail, no pain. But if you keep ripping your nail, and as soon as it passes that nail bed line, boom, then you're going to have pain. So ripping your nail is the same thing as the disc. That jelly can move. There's no pain. There's just a little bit of there's stiffness there. But now, if your disc is hanging out too far, you're really stiff, and then boom, you do something small and you have pain. So why does that disc move around? It's supposed to move around to help absorb shock. But if you maintain one position for too long, you can push it too far. So I always use this as an example. If I'm in a long bus ride across country with my friends, and I turn my head to talk to my friend, there's nothing wrong with this position or this posture. But if I stay like that for a couple hours, what's going to happen? I'm going to be really stiff and sore coming back. Mechanically, what's going on is when you stay in one position, you're pushing your jelly out too far. And then when you try to come back, you're stuck or you're stiff, okay? But you know how to fix that. This is actually a disc bulge. You say to your friend, let's switch seats. I've been in this position too long. And then you start stretching into that discomfort. Pressure on, pressure off, right? Until you achieve full motion. So when you're in one position too long, the jelly goes out the opposite way, and you simply correct it by pushing it back in. Once you have full motion, then that disc is back in. Well, for your low back, you're actually genetically blessed with a nice curve in it, right? And what's important about that curve? We call that curve a lordosis. When we sit slouched, there's nothing wrong with that posture unless you're in it for too long. Sitting slouch usually causes the disc to go backwards too far, okay? And often we're stiff or tight getting up out of the position. That means it's back too far. But with your back, you instantly push it back in place by pushing it forward, okay? So you're opposite of most people's discs are back too far from sitting slouched. You're actually, when you stand too long, your disc is going to go too far forward. Nothing wrong with standing, just like nothing's wrong with turning my head. But if I stay there too long, I'm going to be stiff, and I can simply correct it by going the opposite way. When you stand too long, that disc is getting pushed all the way forward. So when you start to feel pressure build up, before there's pain, you realize you lost the ability to bend forward. Simple to fix. If that jelly's too far forward, we just need to bend to push it back in place. You can bend sitting, pulling the bottom of the chair. If you're standing, you can try to bend one leg, then the other, and then pull down for both, or put your foot on a chair and bend, okay? The other thing that's going to put you out is your hard mattress. Hard mattresses are the best for patients whose discs are going backwards too far. Why? A hard mattress causes your back to be pushed forward. So most people with back problems, the hard mattress is awesome, okay? But for you, you already have a good curve, and now all night it's just being pushed more and more forward. Simply, all you have to do is roll up your sweatshirt, and believe it or not, if there's a tiny bend in your knees, that will cause your back to relax and not hang out in this position all night, okay? So moving forward, just roll up a sweatshirt, just something tiny, let those knees bend a little bit, and it's going to relax that back. And then in the morning, all you got to do is pull your knees into your stomach, okay? So for the rest of your life, once you learn the cause of that back pain, remember the back pain we don't want to hurt anything else in that back. We don't have any fractures. So the only thing that we want to be causing pain is that disc, and that's the most common. If the disc is causing pain, it just means that jelly is touching somewhere on the outer layer. For you, most likely it's going to be too far forward, okay? Because your body's overcorrecting. So all you have to do is simply push it back into place by bending.